COVID has affected each of us, as well as our service users and their families. There's been a lot of change at a fast pace. We all have a story to tell about our COVID journey so far. The Learning from COVID team was formed to listen to these stories, to learn from our experiences, in order to shape a better future for us all. Here we will tell you what was said, the lessons that were learned, and what changes are needed for our future. We captured the stories of our staff and service users in a number of ways. For our staff, we used a team questionnaire and an individual staff survey. We also used a reflective form to allow staff to tell us their own unique story in more detail and how they were personally affected during the first surge. For our service users and families, we used surveys and telephone calls to understand the impact of the pandemic on them and the trust services they received. Overall, there was a sense of pride in the trust, pride in staff and in teams, that they rose to the challenges COVID presented. There was a feeling that the trust was responsive and innovative, but there were many things that could have been better, and these fit across a number of key themes. These are teamwork, innovation, leadership, communication, inequity, recognition, safety and well-being. There was a feeling that teams worked well together, that they stepped up to the mark and moved away from working in traditional silos. But many teams felt fractured because of redeployment, and at times staff didn't know who to turn to. There were feelings of frustration and low morale. We must continue to work across silos and ensure we stay connected with all members of our teams. Lots of innovation was seen across the trust, and there was a sense that new ways of working were made easier because the usual barriers were removed. But not all staff had the same access to the new digital world and ways of working, and many felt disconnected. We must work to improve digital access for all our staff. When working in new ways, we've learned that we need to work more closely with our service users to ensure we're meeting their needs. Some staff were happy with the leadership they experienced during the first surge, but overall there was a feeling that our leaders need to be more compassionate and more visible. Staff who were redeployed needed better clarity about who they were accountable to, and overall staff wanted to be more involved when services were starting again. There is a need for more compassionate and collective leadership behaviours at all levels. Managers and leaders must ensure that they are visible and accessible during future surges and beyond. We must ensure leaders are able to support the health and well-being of their staff. There was a clear message that we need to be better at how we communicate with our staff and service users. Many felt overwhelmed by the amount and speed of information they were getting, and also about how quickly advice changed at times. Some felt they weren't given any or enough information. We must communicate with openness and transparency in keeping with our shared health and social care values. We should have a centralised source of information that staff at all levels can access. Managers should use a range of styles when communicating with staff to reflect the various preferences within teams, and ensure that those working remotely or not digitally connected are always included. Communication must be a two-way process to ensure that the views of frontline staff and service users are heard. There was a feeling of unfairness or inequity across different parts of the trust. This related to whether or not an area had a COVID status, the practices around redeployment, access to IT, and the opportunity to work from home. Our service users and families who were not directly affected by COVID told us they felt forgotten and abandoned. We must ensure that our staff and service users are treated fairly. There was a strong sense of pride and appreciation of our staff and our teams, how they'd risen to the challenge and gone the extra mile. However, not everyone felt this sense of appreciation. Some felt their efforts were not recognised. It's important for managers to understand how their individual staff prefer to be recognised and to respond accordingly. The Trust should work to embed a more consistent approach to recognition across the organisation. Staff appreciated the support put in place for their physical safety, such as the free car parking and food. But there was a call for better social distancing, especially in shared spaces, and for more clarity, openness and transparency about supplies of PPE. In terms of psychological well-being, staff reported increased feelings of anxiety and concerns around their mental health. For staff working in trust facilities, there was a real fear of bringing COVID home, and others working from home felt isolated. We must ensure adequate supplies of PPE and communicate more effectively with staff. We must continue to reinforce the need for social distancing and other behaviours to keep the workplace safe. Psychological support services for staff must be accessible, and we must work to normalise seeking this care. It is important that staff feel they can raise concerns without fear of negative consequences. For further information on the Learning from COVID work, please see below the link to other resources.